We begin with a case history of a 40-year-old female with urinary tract infection and currently using antibiotics. Patient also complains of pain in liver region and tests have shown high ALT in the blood. She also has pain in right arm and shoulder and experiencing some long-term stress. The software will first automatically detect the iris border, autonomic nerve wreath, and pupil. The autonomic detection function offers very accurate mathematical parameters that will perform an important role in the iridological analysis results. We will now let the software do the automatic processing of the eye. If the software has detected the iris border correctly, we then choose the Yes button to accept. If the software has detected the iris border incorrectly, we then choose the No button to configure the iris border manually. The software normally auto-detects the iris border correctly about 90% of the time. The detection in this case is acceptable, although let's try manually setting the iris border parameters by choosing the No button. To manually define the iris border using your mouse, click a minimum of 3 points on the border edge of the iris. You can also make additional points to define the iris boundary. When you have completed making the iris boundary points, press the Enter or Space key on your keyboard. You can also click on the right mouse button to complete the process. Press your keyboard's Delete button to erase any previous point. Click the Yes button if you're content with the green colored circle around the iris border. Click No if you wish to try again. The border parameters are very important since the software's topographical chart will be placed to the specifications of the green circle around the eye. Now for the automatic detection of the pupil. The software will first try to detect the pupil. The pupillary parameters are very important since the software will generate a diagnosis for any detected pupil deformations or decentrations. Choose Yes if the pupil is detected appropriately, or No to manually define the pupil border. In this case, I think we can improve upon the pupil detection and will choose No. To manually define the pupil border using your mouse, click a minimum of 3 points on the pupil border edge. You can also make additional points to define the pupil boundary. When you have completed the pupil's boundary points, press the Enter or Space key on your keyboard, or you can also click the right mouse button to complete the process. Press your keyboard's Delete button to erase any previous point. It is extremely important that the pupil is detected correctly. The highlighted yellow box shows the location on the pupil that may be detected more accurately. We will now choose the No button and try again. This time we will make more than 3 or 4 points. The pupil border is now more acceptable. We can now press the Yes button to accept the pupil border detection. The software will now try detecting the autonomic nerve wreath automatically. The autonomic nerve wreath is most often termed the ANW. I will be using this term throughout this training video. In this example, the ANW was not detected properly. In most cases, we must manually correct the software's ANW detection. The ANW placement is the most time-consuming procedure of the Bexel iris analysis. Many times when there is a strong light source in the iris image near the ANW, shown in the yellow box, it will confuse the software's automatic detection. To place the ANW parameters correctly, click on the ANW border correction. If the A&W border is placed correctly, click on the Border OK button. In this case, we will choose the A&W border correction. To edit the A&W, position your mouse over the original A&W detection. Then press and drag your left mouse button to align correctly with the A&W. Unpress the left mouse button to change to a different A&W location. Use the numbers 1 through 9 on your keyboard to change the size of angle to edit the A&W more efficiently. To become faster in editing the A&W, you must practice. Sometimes it will be difficult to see the A&W, especially with dark brown eyes or blue eyes containing heavy pigment over the A&W. With practice, one becomes more able to differentiate and distinguish the A&W. The autonomic nerve wreath is one of the most important landmarks that an iridologist will analyze. The A&W is well illustrated as a vascular analog for the autonomic nervous system. This circular phenomena is described as representative for the exchange of nutrients and toxic material between the intestinal tract and the humors of the body. This would also include the A&W serving as an index for the lining of the intestinal tract and autonomic nervous system. The A&W distinction, arrangement, and shape identify intestinal activity patterns and its reactive character. It also indicates response of the system to diversified lifestyles, dietary and emotional stress circumstances. Distinct signs that show these tendencies include crypts, stroma density, central heterochromia, radial and contraction furrows. An obscured A&W will commonly suggest a condition of toxicity with potential dysfermentias and dysbacteria, also known as dysbiosis. A thickened A&W may indicate toxic materials leaking through the intestinal walls, thus creating a chronic inflammation of the surrounding lymph. A&W distension and constrictions may also show signs for specific types of physical behaviors. The autonomic nerve wreath is characterized by the following parameters: dimensions of pupillary and ciliary belts, pronunciation, clarity, color, and type of form. In the eyes of newborns, the autonomic nerve wreath is virtually non-distinguishable. Its formation is completed at 3 to 5 years of age. Usually it looks like an even or broken line, elevated over the deep mesoderm layer due to the large trabecules forming this line. It is a dynamic structure, as it can be constricted or increased in volume depending on the continuously changing sizes of the pupillary belt and pupil. Thereby, it is beneficial to carry out biomicroscopic examinations of the autonomic nerve wreath with a narrow pupil by using a bright illumination source. This zone is of great importance for diagnosis because it is the indicator for all activity of the visceral systems and the reference point for topic diagnostics. It is considered that one can evaluate the functional state of the sympathetic part of the vegetative nervous system by the height and width of the autonomic nerve wreath. A regular, close to circular form of the autonomic nerve wreath takes place owing to a balanced interaction of the spinster and dilator. The spinster of the pupil has approximately 70 to 80 separate segments. The widely arranged dilator has similar amount of segments. Consequently, in the regular form of the autonomic nerve wreath, the harmony in the interaction of dozens of segments and muscle antagonists is reached with the assistance of all components of the parasympathetic and sympathetic nervous systems. Good coordination of their work depends on normal harmonic functioning of all internal organs. In normal conditions, the color of the autonomic nerve wreath corresponds with the iris color. An increase or decrease of color intensity, whether it be local or general, should be considered as a pathological symptom. Most iridologists consider the autonomic nerve wreath to be tightly connected with many important organs, so pathological signs of this formation are associated with the pathology of the corresponding organs. The most rough sign, indicative of the most severe pathology, is the rupture. The rupture can point to the irreversible pathology of the vegetative nervous system components or hypofunction of the corresponding organs. For example, rupture in the upper part of the autonomic nerve wreath can take place in neurological symptoms of the cervical section of the spinal column. Special signs of the autonomic nerve wreath are typical for certain diseases. There is Russian data that some changes are intrinsic for people with mental diseases. Besides the structural disorganization of the iris stroma in the brain projection sectors, local protrusion of the autonomic nerve wreath in this area is the most typical sign for schizophrenia. Some individuals have a double protrusion without ruptures. The Russians term this horn syndrome. Local drawing out of the autonomic nerve wreath indicates the pathology of an organ, to which the projection such drawing out is directed. Local drawing out at the lateral departments of both irises are observed in patients with cardiac pathology, such as cardiosclerosis, rheumatic failures, and hypertrophy of the left ventricle. The connection between location, the extent of the autonomic nerve wreath protrusion, and hypertension in certain heart cavities were previously evaluated by Russian scientists. They found that in the left iris, local protrusion in the heart projection was 3 times more likely than in the right iris. It was also noted that the rupture in the heart sector may be linked to aneurysm formation. Ptosis or dropping of the abdominal organs is accompanied with specific changes of the autonomic nerve wreath. Insignificant ptosis of the transverse colon, which can have no clinical manifestations, is reflected in iridology by the flattening of the autonomic nerve wreath in the upper sector. The rough ptosis of the transverse colon, with the prolapse of the abdomen cavity organs, is associated with a pronounced flattening of the autonomic nerve wreath not only in the upper sector, but also in the lower one. In such cases, it is necessary to distinguish the lower flattening from the drawn-in autonomic nerve wreath in the 5 to 7 o'clock sector, which takes place in people with ulcerous disease of the duodenum. To be more precise, it is a marking of the inherited inclination of duodenum ulcer. In bronchial asthma, changes of the autonomic nerve wreath take place in the lungs bronchi sectors. In arthrosclerosis of the lower extremities, the A&W changes will be seen in the area of the brain and pelvic organ sectors. Strictures of the transverse colon can be associated with a local pronounced drawing in of the autonomic nerve wreath. Diverticulum of the large intestine can be associated with the local drawing out of the A&W. Such signs can be multiplied in diverticulosis. Great importance is attached to the violation of the ratio between the sizes of the pupillary and ciliary belts. In the normal state, radial dimensions of the ciliary belt is 1/2 to 2/3 from the iris radius. Deviation from these parameters is often the symptom of nervous system and digestive tract diseases. If computer processing is not available and estimation of the relative dimensions is difficult, the conditional subdivision into the circular areas is applied. The pupillary belt is subdivided into 2 areas and the ciliary belt into 5 areas, with a total of 7 areas as shown. According to recent investigational data, besides the mentioned symptoms of change form, structure, and color of the autonomic nerve wreath, the type of its reaction with different kinds of irritants and other so-called associated reactions seem to be very important issues. It is known that through dilation and contraction of the pupil, the autonomic nerve wreath seems to repeat these movements. In individuals with a stable type of nervous system, such reactions are synchronous and symmetric for both eyes. Through increased or decreased excitability of the central nervous system, consensual reactions are violated. In central organic brain pathologies, symmetry can occur. In some types of psycho-emotional pathologies, synchrony and consensuality may occur. A balanced wreath suggests a positive influence on bowel behavior. The distended A&W represents a widening of the pupillary zone, in which the A&W is widely distended. This exhibits a weak tonus in the gastrointestinal tract due to a lack of innervation of the musculature. A total distension includes a tendency toward chronic constipation and flatulence. An inclination toward poor peristalsis, motor disturbances, constipation, slow motility, poor absorption of nutrients is also indicated. The drawn-in form or indented A&W represents a narrowing of the pupillary zone, also known as a centropadal type. An inclination toward hypertonicity or tenseness of the gastrointestinal tract with a disposition to the spastic variety of constipation is indicated. The lateral distension shows tendencies toward weak intestinal peristalsis with slow transit time. This shows a potential for colon prolapsus, cardioabdominal symptoms, dysbacteria and dysfunction of the autonomic nervous system fibers located in the muscular coats of the intestine. If distension is seen in the left iris, disturbances of the spleen and/or pancreas tail may be found. Lower capacity to digest small amounts of food is also indicated. When distension is found in the right iris, disturbances of the liver metabolic functions may be detected. A tendency toward hemorrhoids may also exist. The local indentation is most often an inherited sign that indicates disturbances of the autonomic nerve circuitry from the organ reflected in the iris sector to the autonomic nerve center. The ventral distension indicates a slackening of the tonus of the abdominal blood vessels. This shows a tendency toward hemorrhoids, enteropatosis, prostrate hypertrophy, low back pains, and energetic weakness of the lower extremities. The frontal indentation or flattening indicates prolapsus of the transverse colon with tendency to cause pressure in the lower abdominal organs. Psychological implications such as psychoneurotic difficulties may be found. The bilateral distension or drawn out form indicates a slackening of the small and large intestines. A tendency toward chronic atonic constipation, dysbacteria, and flatulence can exist. The zigzag collarette or tooth form represents a hyperkinetic gastrointestinal tract that can include an accelerated transit time, spastic irritation, constipation, strictures, diarrhea, intestinal inflammation, and colic. There is compromised nerve energy in the zigzag points. Psychological inclination to mood swings and anxiousness may exist. The partial zigzag or tooth autonomic nerve wreath, when found in the upper iris reaction field, psychological indication may be encountered. If found in the lower iris reaction field, sigmoid or rectal spasticity and flatulence may be experienced. When detected in the liver reaction field, it can indicate alternating constipation and diarrhea. If any of the zigzag signs are found in children, dairy products need to be removed from diet. A wavy distension indicates weak tonus of the entire intestinal musculature, flatulence, dyspepsia, and chronic catarrh oppression. This suggests that the GI tract should be the main focus for health maintenance. Local protuberance indicates a tendency to diverticulosis and also implies a weakness to the corresponding section due to a lack of nerve provision and a lack of nourishment. The hyperplastic denotes a lightened or thickened autonomic nerve wreath, representing an irritable autonomic nervous system. It is an indication of disturbances in the GI tract, such as dysfermentia, diarrhea, colic, flatulence, increased peristalsis, and painful spasms, immoderate energy stored in the stomach, and gastrointestinal motor disturbances. The hypoplastic denotes a thin or thread-like autonomic nerve wreath representing a delicate nervous system. This is an indication for psychosomatic sensitivity with a tendency towards neuritis and neuralgias. Sensitivities may include external factors such as weather, temperature and atmospheric changes, sound, light, emotional sensitivity, and lack of nerve energy and stamina. The bowel is also easily irritated. The peral tract is also known as a double collarette and indicates potential hypermotility with alternate diarrhea and constipation. Potential prolapses from weak connective tissue subsists. This may display psychoneurotic and psychosomatic tendencies. This is an inherited characteristic, and there may be a family history of apathy, depression, and suicide. If this sign is located temporally or immediately, possible nervous asthma, cardiac rhythmic disorders, and cardiac neurosis may be indicated. The square-shaped autonomic nerve wreath is a phenomena that develops slowly and gradually over time and may be characteristic of an inherently weak sympathetic nervous system. An inability to efficiently utilize nutritional components and allergic reactions may be detected. A poorly defined or absent A&W indicates an insufficient autonomic nervous system with inhibited regulatory capacity. Reaction and resistance to negative influences is usually difficult. Feeble digestion with inclination towards spasms, appetite disorders. There is often association with psycho-emotional disturbances producing hopelessness and fatigue symptoms. If detected in children, possibilities of an intestinal colic, low calcium absorption, body development disturbances, stomach appetite weaknesses, food intolerances, nausea, excess catarrh may be indicated. Sectorial absence may be understood as an inhibition of enzyme synthesis in the digestive tract with poor mineral and vitamin assimilation, specifically calcium, magnesium, and vitamin A. The funnel type appearance is an indication of weak muscle and connective tissue. Possible hernias and other tissue displacements may be considered. The autonomic nerve wreath border for the left eye is now complete. It is important to observe any autonomic nerve wreath sections that draw in toward the pupil or draw out toward the ciliary zones. We will now complete the right iris autonomic nerve wreath and pupillary parameters. The software will now detect the iris border automatically. The software has detected the iris border suitably, therefore we shall choose yes. The software will now try detecting the pupil automatically. The software has detected the pupil quite accurately, but let's see if we can do better. We do this by choosing No to try to detect the pupil manually. Mark at least 3 points to define the pupillary border. I recommend choosing more points, especially if you see a pupillary deformation such as a flattening. It is important to observe for pupillary flattenings and diverging ellipses. The software will now try detecting the autonomic nerve wreath. In every case, we will have to manually correct the autonomic nerve wreath border to some degree. The autonomic nerve wreath placement is now sufficient. The software will now analyze the pupillary and autonomic nerve wreath placements. Important calculations by the software are now accomplished at this time.